If you've ever had jaw pain, clicking, ear discomfort, or even trouble closing your mouth fully, today's video may help. We're talking about the lateral pterygoid, a small but powerful muscle that often gets overlooked in the jaw. And I'll show you a simple way to self-treat it at home. The lateral pterygoid has two parts, or heads, a superior and an inferior head. The inferior head helps you open your mouth and move your jaw forwards. The superior head works more during clothing, helping guide the jaw and the disc back into place smoothly. If either head gets tight, you might notice jaw pain, clicking, or even ear-related symptoms like ringing or fullness. Trigger points in the lateral pterygoid often refer pain deep inside the joint or towards the ear. Here you can see common referral areas. Hi, I'm Robert Hackwood, lead instructor for Dynamic Therapies. Let's check in with our jaw and feel how it's moving. Place your fingers over the temporomandibular joints, just in front of your ears. Hold them there lightly while you open and close your mouth. Is there any clicking, grinding, jerkiness? Do they feel the same on the left and the right? Is it a loose and easy feeling or a tight and stiff one? Remember this so we can compare at the end. Now let's talk about how you can gently self-treat this muscle. This one's a little tricky because it sits deep inside your cheek. Wash your hands. You don't need to wear a glove. You can if you want, but you don't have to. Place your index finger inside your mouth, sliding it up above your gums and back behind your upper back teeth. Open your mouth slightly and slide your jaw sideways to create more room. Play with it a little and get the space to open up for your finger. The pad of your finger stays close to the upper jawbone. Slide it upwards and curl it in to follow the contour of the bone. It will feel like a little fleshy pocket. The tip of your pinky is pushing into it. You know you're there when you squint and feel intense pain. Now back it off. It doesn't have to be that painful. You may feel tenderness or even reproduce some of your pain. That's normal. Hold gentle pressure for about 10 to 20 seconds, then let go. Do this a few times, but don't overdo it. The key is gentle, not forceful. Doing several repetitions is good. Feel for the muscle to soften like you're melting an ice cube with your fingertip. Remember to breathe and keep your shoulders down and relaxed. Open and close and retest your jaw. Does it feel any different? If it opens wider but now clicks, that's actually a good result. Well done. If you're a manual therapist looking to learn how to treat the TMJ, I show 4 different ways to treat this muscle in my Simply TMJ webinar. The link is in the description. So when is this helpful? After dental work, where your mouth was held open. If you notice joint clicking, ear or deep joint pain, or difficulty fully closing your mouth. If any of these sound familiar, this little muscle may be involved. Remember, the lateral pterygoid is just one piece of the puzzle. If your symptoms don't improve, other muscles and tissues may also need attention. Here's a video on another overlooked jaw muscle, the temporalis. If you found this helpful, please like and subscribe.